For some women, getting pregnant might be easy. While for others, getting pregnant can take years and involve a lot of pain. In this video, I am going to give you some effective tips to get pregnant fast. While trying to get pregnant, the range of experiences are so different, because there are so many factors that affect the process. Which is why, even for a healthy fertile woman in her early 20s, the chances of getting pregnant are just 25% in any given month. That's why, timing ovulation, or knowing the days your body is ready to conceive, improves greatly your chances of getting pregnant. Luckily, these days there is an excellent understanding of conception and the biology behind it. Before we start with the tips for getting pregnant fast, let's start by understanding the process of ovulation. Ovulation is a part of the menstrual cycle. It occurs when an egg is released from the ovary, travels through the fallopian tube, until it reaches the uterus. When the egg is released, it may or may not be fertilized by the sperm. If it is fertilized, the egg implants within the cavity of the uterus, to develop into a pregnancy. If is not fertilized, the egg disintegrates and the uterine lining is shed during your next period. Ovulation typically happens around day 14 of a 28-day menstrual cycle. However, not every woman has a 28-day cycle, so the exact timing can vary. In general, ovulation occurs in the middle of the cycle. How to know if you are ovulating? Ovulation may cause some symptoms. Here you have a list of them. Light bleeding or spotting, breast tenderness, increased sexual drive, ovarian pain, usually characterized by discomfort or pain on one side of the abdomen. After we understand how conception happens, let's get into the tips to get pregnant fast. Tip number 1. Plan and get ready for pregnancy. Male and female fertility rely on a delicate balance of hormones. These can be influenced by environmental factors, food, toxins, age, stress and other emotions, illness, physical activity, etc. One of the key factors for women to increase fertility is to be aware of their menstrual cycle and the influence of external factors. For men, an understanding of their own fertility and steps to achieve sperm health are also a critical component of increasing a couple's fertility. For this tip specifically, be mindful of your surroundings, try to be a better and more healthy version of yourself in general, and also visit your doctor to make sure that all your organs are normal and ready to conception, that there are no ovarian cysts, fibroids, or any other female issues that needs to be resolved before conception. Also, if you have any pre-existing conditions like thyroid or heart problems, high blood pressure, diabetes among others, those conditions needs to be checked before you start a pregnancy. Tip number 2. Have you heard that some foods might increase your fertility? Here you have a general list to look, if you are trying to get pregnant fast. Try to stick to a balanced diet, that includes lots of fruits and vegetables, particularly green leafy vegetables and legumes, low complex carbohydrates and low-fat protein including meat, poultry, and fish. Dairy foods appears to have positive benefits in supporting conception as well. Avoid fatty foods, highly processed foods and foods high in sugar, as these can impact hormone balance. Trans fats may also impact fertility. Among the highly processed foods you'll find chips cooked in fat, and highly processed cereals, pastries, pies, cakes, and pizza. While fish can be an important part of a healthy diet, increasing levels of toxins and heavy metals may make some fish a risky food choice when you are trying to maximize your fertility. Smaller fish like sardines tend to have a lower risk of toxins and are rich in omega-3 fatty acids, but larger fish like shark can be higher in heavy metals like mercury. Also avoid sweet drinks. Herbal teas and water are the best drinks. Fruit juice is high in fructose, which can interfere with the sensitivities of insulin and other hormone balance. Tip number 3. Quit smoking and drugs. There is solid evidence that shows that smoking tobacco or marijuana, or taking recreational drugs, all have a negative effect on fertility. In women, cigarette smoking can disrupt egg maturation, follicle development, ovulation frequency and fertilization rates, with eggs exposed to nicotine having higher levels of chromosomal abnormalities. Smoker women also have increased rates of miscarriages and less success of a positive pregnancy with IVF or in vitro fertilization treatments. In men, smoking can lower sperm count and motility and has been found to increase abnormalities of sperm shape and function. Tip number 4. Reduce caffeine. There are a number of studies that show direct links between high levels of daily caffeine consumption, more than 300 milligrams a day, and low fertility in both males and females. And continued high intake of caffeine during pregnancy increases the risk of miscarriages. Tip number 5. Reduce or avoid alcohol completely. Even relatively small amounts of alcohol can have a negative effect on both male and female fertility. Moderate to high levels of alcohol consumption in women is linked to increased miscarriage risks, ovulation dysfunction, and abnormal development of the endometrial lining. Moderate to high levels of alcohol consumption in men is linked to abnormal liver function, raised estrogen levels interfering with sperm development, and a significant drop in sperm numbers. Tip number 6. Keep stress levels under control if you can. There's evidence that chronic or intense stress can affect your reproductive system. Studies suggest that women with higher levels of stress have an increased risk of infertility. And of course, having trouble getting pregnant can cause quite a bit of stress as well. So, if you feel that your stress levels might be affecting your health and your ability to conceive, talk to your doctor about ways to cope. Several studies have found that alternative medicines such as acupuncture have actually shortened the time it took for infertility patients to get pregnant. Meditation and yoga are great ways to find peace and control stress as well. Tip number 7. Pay attention to BPA. Some studies have led scientists to believe that high BPA exposure could mess with men's and women's fertility. BPA is a chemical found in some plastic items, such as water bottles, food containers, and even in the interior of aluminum cans. BPA potentially can lower sperm count or reduce the number of viable eggs. Therefore, limit your BPA exposure by avoiding canned foods, and avoid consuming anything from a plastic container with the recycling number 3 or 7. This number is usually found on the bottom of the container. Tip number 8. Exercise to increase fertility. Regular to moderate physical activity like walking or cycling cut down the amount of time it took women to get pregnant. A healthy weight is crucial for increasing fertility. Is harmful to be obese as it is to be underweight. Check with your doctor to achieve a normal and optimal weight. Keep in mind that the human body is very complex. Not enough physical exercise can reduce fertility in both males and females, and too much activity will also have a negative effect on fertility as well. Therefore, balance is the key. Aim for a healthy, balanced routine for your diet, exercise, rest, and activity. Always speak with your healthcare provider if you have any individual concerns that may be impacting your fertility. And here you have it, 8 effective tips to increase your fertility and give your body a boost to get pregnant fast. I hope these tips are helpful to you. Before you go, don't forget to subscribe to my channel and turn on the notification bell to be notified every time I upload a helpful video for pregnancy, babies, and motherhood.